Hello, my name is Dr. Laura Lynn Randalls. I'm a teacher of the visually impaired and orientation and mobility specialist. Let's take a moment to talk about what an FVLMA is and how you can help prepare. In the first few years of your child's life, you have undoubtedly had acronym after acronym thrown at you, and this is no other. And sometimes that can be a bit scary. An FVLMA is a functional vision learning media assessment. It's a fancy way to say that we're looking at the vision that your child has and how they can use it best. To get here, you and your child have likely visited a multitude of medical professionals and vision specialists. The vision specialists are charged with checking the health of the eye and your child's optimal vision abilities. As a teacher of the visually impaired, my job is to start with the FVLMA, or the Functional Vision Learning Media Assessment. This assessment helps us to find your child's vision and non-vision skills that will guide their access to the educational content and experiences of their next few years. The next video in this series will break down what an FVLMA process looks like, but let's spend a few moments to explore some tips that will help you feel a bit more prepared for this process. One of the most important things for you to remember as you enter this process is that you are a member of this team because you are the expert in your child. There's an old teaching adage that says that we get them for 7 hours a day. Well, you have them for 17. We will never be able to know your child as well as you do. Because you are that expert for your child and you are likely to be the only consistent team member throughout your children's educational journey, I do suggest creating a portfolio. This is a great way to also help avoid having to repeat yourself or having to sift through old documentation to find exactly what you need. As you create that portfolio, I really like to break it into 3 sections. The first section is truly all about the child. What do they enjoy? What do they like to do? What do they want to do? What motivates them? What does a day at home look like for your child? Where do you like to go with your child? Do you have frequent outings? How does your child communicate with you and those around you? The second section is truly my favorite. I love seeing photos of your child at home. What do they love to get into? What do they love to explore? Show me some of their adventures and some of the skills that they have. It's a great way to connect and build in that from the core. The final part of the portfolio seeks to save you some time and a bit of the emotional roller coaster. In this section, I encourage you to keep your important documentation for your child. This can include things like vision reports, recent school documentation, and potentially any goals that they have worked for previously. It's all extremely helpful to the current TBI. I would also suggest a list of their relevant medical conditions, any daily or response medications, along with any services that they may receive outside of school. This just keeps us all informed and all of our ducks in a row so that while we're working together as a team, we can best support your child. The final piece that I do suggest including is a narrative about your pregnancy journey in the first few years of life. If you have been part of an IFSP meeting or an IEP meeting in the past, you know that this is reviewed annually and can prove to be painful for some families to relive. By having this narrative, you remove your need to repeat and relive. Due to a variety of factors, it may be difficult to find the perfect time for the evaluation with your child. However, it's crucial that we find a time to observe your child in an appropriate setting. For each child, this may look a little bit different. If your child is struggling with distance tasks, it may be most appropriate for us to come into the classroom and observe as they're doing a spelling lesson or a writing lesson on the board. If your child is struggling with vision-guided tasks, it may be most appropriate for us to come in during a classroom craft activity or while they're working in centers. It's okay for you to speak up if you don't agree with or if you don't understand the setting choice that your evaluators made. A parent recently shared with me that their child was evaluated in PE and on the playground with the primary educational concern of tasks at a distance. This was likely not the most appropriate place to observe the child. Trust your gut. Throughout the evaluation process, it is actually quite normal and best practices for an evaluator to reach out to you. They're going to ask you questions about how your child is at home and what they do in their community and things like that. along with any concerns that you might have. This is a perfect opportunity for you to get to know them as well. Results may vary, and that's okay. Earlier, I mentioned that the doctor tested your child for their optimal vision. For many people, the best that we can see may not be the most functional. For example, your child's doctor may indicate that their visual acuity is around 20 over 200. What this means is that what the average person can see at 200 feet, your child needs to be about 20 feet away for the same level of acuity. But due to things like lighting and distractions and the length of time that they're expected to maintain that vision, all play a part in function. The functional vision learning media assessment guides us to what is maintainable and realistic for your child throughout their educational day. This includes accounting for how tired their eyes may get throughout the day due to intense focus. So you may see things like acuity seem much worse on the report that we give you. This is completely normal. You will also see a variety of different measures and suggestions that get us to that level. For example, you may see things like font size, reading distance, and lighting needs.